Dear student, welcome back in today's lecture. Today we are going to see the second part of drug acting on Parkinsonism. In first part, we had seen that what is the basic physiology of Parkinsonism, what are the possible symptoms of the Parkinsonism, what is the bottleneck for the Parkinsonism, means which is the exactly condition by which the Parkinsonism could be treated. That is nothing but deficiency of the dopamine. So depend upon this, we could analyze, or depending upon this, we could suggest that the line of treatment for the Parkinsonism is trying to maintain the balance between dopamine and acetylcholine. As well as, depending upon this mechanism, the classification of drug acting on Parkinsonism is we had seen. As well as, we had seen the mechanism of levodopa and why this levodopa should not be used as a single medicine. Its combination, what type of benefits are giving, that all the points we had seen in first part. In second part, we are going to see, so along with this mechanism of action, as the drug is producing its action as the anti-Parkinsonism, so along with this mechanism, drugs is also having another effect. The drug is also having effects on other body parts like some heart or other system like blood circulatory system. So what could be the possible effects on these part that we are going to see in today's lecture? This point is very helpful for understanding the possible adverse effect of that particular drug. And this point is helpful for collecting marks in our annual examination under question number 3 as adverse effect for or drug of choice, as well as in question number 6, that is a give reason. So it is one of the very important chapter which is related with the collection of the mark. So let's start with our today's part, that what is the pharmacological action of this drug on some other body systems. So initially we are going to see the effect of drugs on central nervous system, which is our main target by which produces its effect. So it hardly produces any effect in normal individual or in patients with other neurological disorders. Marked symptoms improved occurs in Parkinsonism, particularly a patient showing a very high hypokinesia, as well as tremors are there, and rigidity is one of the very key symptoms for the Parkinsonism. So with the treatment of this drug, the symptoms like hypokinesia, rigidity is started for improvement. And one of the very remarkable point, that is a tremor. These tremors are started for resolving with the treatment of this Parkinsonism. As well as some secondary symptoms like posture, some handwriting, speech, facial expression, mood, and these are the some points. Due to that, the interest in life is get reduced. But treatment with Parkinsonism, anti-Parkinsonism drug, these all symptoms are started for the improvement, and which helpful for the interest in life of patient, normalize the patient very gradually. So apart from this central nervous system, these drugs are also having effect on cardiovascular system. So dopamine from peripherally sites can causes tachycardia by particularly acting on beta adrenergic receptor, as well as centrally this dopamine decreases the sympathetic outflow, and which results in there is a postural hypotension. It produces postural hypotension. So what do you mean by postural hypotension? In next slide we will see what is exactly the postural hypotension, and these are all the things gradually tolerated. Gradually when the treatment is started, it starts for the tolerance. As well as along with cardiovascular system, next point is that is a CTZ. CTZ, that is nothing but chemo trigger receptor zone. For what purpose this chemo trigger receptor zone plays a role? This chemotrigger receptor zone is responsible for the nausea and vomiting in our body. What the dopamine does, whenever the concentration of dopamine is increases in a brain, it excites this CTZ. And due to the excitement of this CTZ, it induces the nausea and vomiting. So this is the one of the very common symptom with an dopamine due to excessive use of the dopamine. Why nausea vomiting? Today we are seeing why nausea vomiting. Nausea and vomiting is because of the excitement of CTZ, chemotrigger receptor zone, and this is also gradually tolerated. Last one that we are going to see, that is a with endocrine system. Generally, this dopamine acting on pituitary and it inhibits prolactin releases and increases the increases the GH releases. Along with this CTZ, endocrine, it acts on endocrine system by acting on pituitary gland and inhibit prolactin releases and increases the GH release. So these are the different effects of this dopamine, effect of the dopamine, excessive effect of the dopamine on our body system. Next point, with respect to that, what are the possible adverse effects? Possible adverse effect, that one common effect that we had seen, that is a nausea and vomiting. Why there is a nausea and vomiting? Because it activates the chemotrigger receptors. So due to the activation of chemotrigger receptor zone, it gives a nausea, vomiting, and gradually it decreases. Next point that we had seen, that is with cardiovascular system. So here we can see that there is a postural hypotension. The patient is observed the postural hypotension. Now, what do you mean by the postural hypotension? Let's see. Here you can observe that. Here, initially, this lady was seated in a chair. When she stood up, immediately she observed that she is having some vertigo. Why this vertigo is there? This vertigo is because of the postural hypotension. It is because of the postural hypotension. Postural, that is nothing but the position. When the patient was in lying state or a sitting state, there is one blood pressure. And when suddenly gets stood up, at that time also, again, there is a change in blood pressure, vice versa, standing to or bending or lying down. So there is a normally changing in a blood pressure, but with respect to this particularly dopamine, the patient shows the postural hypotension. Immediately patient is having little bit vertigo or little bit changing blood pressure. She is uneasy. She feel some uneasy condition, and this is also gradually tolerated. Next one is that cardiac arrhythmia. So this diagram gives an information about the normally how heart is beating. Here, see, this is a normal heart beating, contraction and relaxation. It's in a rhythm. It's in a particularly rhythm. So with this rhythmic condition, heart is pumping, heart is contracting and relaxation. But with respect to this diagram, if you see this diagram, so see, this is not a rhythm. This is not rhythm, and this is a so fastly contracting and relaxing. It is not completely relaxing or not completely contracting. It is a little bit abnormal condition. So that we can say here it is a cardiac arrhythmia. It is a cardiac arrhythmia. So this patient gives some cardiac arrhythmia like condition. So this cardiac arrhythmia is because of again some dopaminic condition. Last slide we had seen with respect to the cardiovascular system, it gives some changes. It centrally it produces another effect, as well as locally it gives another effect. With beta adrenergic receptor, it gives cardiac stimulate effect, that is a cardiac arrhythmia, and while in peripheral it gives postural hypotension. So these are the two adverse effects with related to the cardiovascular system. Along with this, other are like there is a change in alteration of sensation. There is a change in alteration of taste sensation. The patient is unable to take a proper taste. There is a change in alteration sensation. Along with this, some behavioral changes are there. Behavioral changes are like after the prolonged use of such type of medicines for the treatment of the Parkinsonism or increase in the level of dopamine, it gives some effect like some abnormal muscle contraction. So with respect to the abnormal muscle contraction, the patient gives a typical effect that is is has some chafing like feeling or chafing like movement. In his mouth something is there, or he is chafing, or someone could say that he is having some tobacco chewing habit, or someone could say that he's another chewing habits. But it's not habit, it is because of the muscle movement. It is because of the muscle movement. So this abnormal muscle movement gives a symptom like an chewing muscle effect, as well as the facial tics and behavioral effects like sometimes unknowingly, unnecessarily anxiety. There is no any specific condition, but still they are giving anxiety effect. Along with this, one of the very dangerous thing that nightmares. So in this particular condition, if you see this is a nightmare. So in this nightmare, they are getting little bit some different dreams, and even though they have any such a condition, but still they are having a fear that someone is coming in their room and someone is coming in their bed and they are giving some impression, they are giving some such hammering effect likewise. So it's a nightmares. This is one condition that we call as a nightmare. As well as here you can see that is some depression like condition is also there, some depression like condition also there, as well as that is an hallucination. There is no one there, but still he is feeling that someone came there and see. So he is sitting there and here one person is there, here one person is there. So these are the shadows are there. So they are not in a real, but he is feeling that someone is came there and they are started to talking with him, giving some harassment and hammering likewise. So it's type of hallucination. There is no any reality, but still he is feeling that someone is there. That we call as a hallucination. As well as there is a one condition that we call as a mental confusion. In smaller things, the patient is get confused. A lot of the things are there that because of these all the things he could say is that there is a mental confusion. So there is no any specific reason, but still there is a confusion that we call as a mental confusion. As well as most important thing is that the patient is having fluctuation in motor performance. Fluctuation in motor performance that is near about correlate with the movement of the body. Movement. So correlation with the movement is little bit get changed. So sometimes it is very normal, sometimes it's a little bit confusing, there is a little bit change in the correlation. So likewise, so these are the some symptoms that are because of the increase in the quantity of dopamine. Why I am giving somewhat little bit pressure on these points, or why I am giving some that much more time for this condition, because if you see this is a conditions because of increase in a concentration of the dopamine. Why here dopamines are increased? Because we have given a treatment for the patient Parkinsonism. What is a Parkinsonism? Parkinsonism is a condition where dopamine level is decreased. And when we have given a treatment, we are trying to maintain a balance of the dopamine, trying to maintain the balance of the dopamine and acetylcholine. So maintaining a concentration of dopamine and acetylcholine, we are trying to maintaining increase in concentration of dopamine. And as the concentration of dopamine is increased, it gives such type of mental behavioral some symptoms, some mental behavioral symptoms. So what all these are giving idea, these all are giving some indication idea about that due to the increase in concentration of dopamine, the patient shows some effects like nightmare and anxiety, depression, mania, hallucination, mental confusion. So our next chapter, which is related to the psychology, which is related to hypnotic, sedative and antidepressant, these are the chapters which are correlate with this point. So these are the adverse effects, and these adverse effects are also helpful for our understanding in respect to the question number 3. Now next point is, which is a very important thing, that is a combination of levodopa with carbidopa or benzodiazepine. So benzodiazepine, why this drug benzodiazepine or carbidopa is preferred? What is the reason behind that? So let's see. Many times in exam they have asked this question. So question is carbidopa and let's see. Carbidopa and benzodiazide are the extra cerebral dopa decarboxylase inhibitor. That is the most important thing. What do you mean by extra? Extra, that is nothing but outside. Cerebral, that is in a brain. Outside the brain, there is a dopa decarboxylase enzyme. And this dopa decarboxylase enzyme is responsible for metabolism of the levodopa. Metabolism of the levodopa. So, levodopa metabolism necessary, but where it is needed, the levodopa should convert it to the dopamine only in brain, only in central area, not in peripheral area, not in extracerebral area. And this dopa decarboxylase get inhibited by the carbidopa and benzodiazide. Thus, prevent the peripheral conversion of levodopa to the dopamine that we had seen. One more very important thing, very important benefit is that it do not inhibit the conversion of levodopa to the dopamine in brain that we want. We don't want convert of the levodopa to the dopamine in peripheral area. We want its conversion in a brain. We want a conversion in a brain, and these are acting on extracerebral area. They are acting on extracerebral area. So this is the most important thing. We want it should act on a brain. And as they do not crosses the, why they are not acting, why they are called as extracerebral? Because the very simple thing is it does not crosses the blood brain barrier. That is the reason. Next one is that along with this, there are some important benefits. There are important following advantages. The advantages are like the plasma half-life of levodopa is prolonged because of the combination. Plasma half-life of levodopa is prolonged along with decrease in a dose of the levodopa. Near about approximately 1/4 doses get reduced, which is the giving prolonged plasma half-life. Second thing is that the systemic concentration of dopamine is reduced. Systemic concentration of dopamine is reduced. This is one of the very important things. Why? Because if the systemic concentration is there, definitely it produces effect on another body parts as well as the system that we don't want. It want only in the brain. So due to that, definitely our next point is that thus the peripheral side effect like nausea, vomiting, as well as the cardiovascular complications are get reduced. This is the most important. Why? Because systemic concentration of dopamine is get reduced, and thus the therapeutic level of levodopa can be attained very quickly. Therapeutic that we want, the therapeutic level of levodopa can be attained very quickly, and the degree of improvement is higher compared to the individual levodopa. And as the degree of improvement is higher, the patient shows very fast response. The patient shows good improvement with low quantity of the levodopa. So these are the reasons. That's why we are preferring the combination of levodopa with the carbidopa or benzodiazide. This is the one of the very important thing. So many times in exam it could ask. So this is what for our today's chapter, that the drug acting on anti-Parkinsonism. What are the important points under this chapter? The first thing is that basic concept about the Parkinsonism. What is the basic cause? Why the Parkinsonism is there, and what is the basic cause for that? That is a lack of dopamine, imbalance of the dopamine and acetylcholine. So how could you maintain? Definitely we can maintain with the help of the two ways: decrease the concentration of acetylcholine and increase the concentration of, second method is increase the concentration of dopamine. So what are the possible things that could maintain that? Definitely the symptoms like hypokinesia, mood, as well as the mask like impression, mask like facial expression, and body movement, coordination between the movement is gradually increases, improved. And what are the possible adverse effect? The possible adverse effect that due to the increase in concentration of dopamine, there might be possibility of some cardiovascular as well as some chemotrigger receptor zone related activities like increasing nausea vomiting with cardiovascular, postural hypotension, as well as give some cardiac arrhythmia like effect. Along with this, some behavioral effect like depression, anxiety, then mania, hallucination, nightmares, and such type of effect could be possible. Or effect, some shaving like mouth expression is always because of the muscle abnormal behavior. So these are the points that we had seen, and last one that we had seen, that is the combination of levodopa with the carbidopa as well as the benzodiazepine. So this is what about today's lecture and this chapter. Thank you very much.